If you've been using NAC for many years, then I'm about to share with you a unique alternative that you might want to consider. Think NAC is the ultimate detox hero. There is a catch most people miss. While everyone is obsessing over NAC's glutathione benefits, there is some peer-reviewed research revealing hidden risks that could actually work against your health goals. Meanwhile, a bile acid called TUDCA is quietly outperforming NAC across multiple pathways without the downsides. Today, we are diving deep into what the research actually shows. Now, to set the stage, let me briefly explain how NAC works. Before we get into concerns, NAC, N-acetylcysteine, has earned its reputation through one primary mechanism, the glutathione pathway. Here is how it works. NAC gets converted to cysteine in your body, which then serves as the rate-limiting substrate for glutathione synthesis. This happens through two enzymatic steps, glutamate cysteine ligase and glutathione synthetase working in sequence. The established benefits are solid. NAC is Food and Drug Administration approved for acetaminophen overdose with nearly 100% efficacy when given within 8 hours, according to Prescott and colleagues. It is also clinically proven for respiratory applications. A meta-analysis of 523 chronic obstructive pulmonary disease patients showed NAC reduced exacerbations, particularly in patients not on inhaled corticosteroids. The mucolytic effects are well documented, breaking down mucus proteins through disulfide bond reduction. But here is where things get interesting. Rushworth and Megson's review in Pharmacological Therapeutics revealed something crucial. NAC's oral bioavailability is only 4 to 10%. Most of what you are taking never makes it to where it needs to go, lost to first-pass metabolism in the liver. This low bioavailability is just the beginning of NAC's hidden challenges. Now let's examine the warning signs that most people are missing about NAC supplementation. Everyone mentions that NAC can cause nausea, but the research shows this is not just a minor inconvenience. A comprehensive review in Antioxidants found that up to 23% of patients experience nausea and vomiting with oral NAC. The mechanism is not just the sulfur taste. NAC's mucolytic properties actively affect your gastric mucosa. In pediatric cystic fibrosis studies, 1 out of 11 patients dropped out due to severe stomach pain at 2,400 milligrams daily doses. The dose relationship is clear. Higher doses above 1,800 milligrams daily show significantly increased gastrointestinal intolerance. This matters because therapeutic effects often require these higher doses. As a potent antioxidant, could NAC impact training adaptations? Peterson and colleagues' study in Journal of Physiology showed that NAC infusion before and during exercise blocked key adaptation signaling. Specifically, NAC prevented exercise-induced JUN N-terminal kinase phosphorylation and reduced gene expression of manganese superoxide dismutase, a critical adaptation marker. The mechanism is straightforward but problematic. Exercise creates beneficial oxidative stress that triggers adaptation pathways. NAC's broad antioxidant effects suppress these signals. As Slattery's Sports Medicine review concluded, antioxidant supplementation may improve acute performance, but impair long-term training adaptations. If you are taking NAC for health benefits while trying to get stronger, you might be working against yourself. Now let's look at the thyroid angle, because hormones are a big part of overall health. NAC also may impact thyroid hormones. Importantly, research in this area is complex and still ongoing. Vidart and colleagues' randomized clinical trial in Journal of Clinical Endocrinology and Metabolism studied 67 heart attack patients. Those receiving NAC 1,200 milligrams intravenous every 12 hours for 48 hours had significantly higher T3 levels compared to placebo at 12 hours. While preventing T3 decline during acute illness sounds beneficial, a study in obese adults found NAC significantly decreased DIO3 gene expression in visceral fat tissue. DIO3 is the enzyme that inactivates thyroid hormones. NAC appears to affect thyroid hormone metabolism in ways we are still understanding. For people with existing thyroid conditions or those taking thyroid medications, this represents an uncharted interaction zone. Next, let's talk about blood clotting and vascular effects, because safety during procedures matters. NAC has significant anticoagulant effects that that many people do not realize. Niemi and colleagues' European Heart Journal study found 33% decrease in prothrombin time with NAC infusion versus 6.5% with placebo. NAC also potentiates nitroglycerin effects, causing severe headaches in some patients. Prothrombin time is a measure of how long it takes blood to clot. When NAC decreased prothrombin time by 33%, it means blood was clotting much faster than normal, which actually indicates a procoagulant, clot-promoting effect rather than an anticoagulant effect. However, the study authors concluded that NAC has anticoagulant and platelet-inhibiting properties based on other measures like prolonged coagulation time in thromboelastometry and decreased platelet aggregation. The decreased prothrombin time appears to be one measure among several conflicting coagulation effects, making NAC's overall impact on bleeding risk complex and potentially unpredictable in surgical patients. Now let's address the longer-term safety signals that raise eyebrows. But perhaps most concerning is research from Bro and colleagues' study that found that 10% of normal aging mice on NAC developed lung adenocarcinoma compared to 0% in controls. In oxidatively stressed mice, this jumped to 50% versus 0% in controls. The proposed mechanism, NAC, may prevent senescent cells from dying naturally, allowing transformation to cancer cells. A Science Translational Medicine study showed NAC and vitamin E accelerated tumor growth in mice with BRAF/K RAS mutations by reducing p53 expression. While these are animal studies, they raise serious questions about long-term NAC supplementation, particularly in high-risk populations like smokers or those with existing small tumors. Now let me introduce you to the compound that is changing the cellular protection game entirely. TUDCA, tauroa sodioxycholic acid, takes a completely different approach to cellular protection. Instead of relying solely on antioxidant activity, TUDCA works through bile acid signaling pathways that address the root causes of cellular stress. TUDCA is a hydrophilic bile acid that forms when the liver-produced compound eusodioxycholic acid conjugates with the amino acid taurine. TUDCA has been used in traditional Chinese medicine for over 3,000 years as a component of bear bile, where it was valued for treating digestive disorders, reducing inflammation, and supporting liver function, though modern TUDCA supplements are now synthetically produced rather than derived from animal sources. Unlike NAC's indirect glutathione approach, TUDCA directly stabilizes cellular membranes and modulates survival signaling. Moving on to mitochondria, while NAC protects mitochondria primarily by replenishing glutathione stores, TUDCA uses multiple direct mechanisms. Rosa and colleagues' studies showed TUDCA enhanced mitochondrial biogenesis and prevented mitochondrial fragmentation. TUDCA prevents cytochrome C release, maintains adenosine triphosphate production, and promotes mitochondrial quality control through Parkin-dependent mitophagy. Now let's examine the endoplasmic reticulum, because protein folding stress is a major driver of inflammation. Here is where TUDCA really shines. The endoplasmic reticulum manages protein folding and cellular stress responses. When overwhelmed, it triggers inflammatory cascades that contribute to numerous health issues. TUDCA acts as a chemical chaperone directly inhibiting all three branches of the unfolded protein response. A clinical study in ulcerative colitis patients found 1.75 to 2 grams TUDCA daily for 6 weeks produced significant reduction in endoplasmic reticulum stress markers and disease activity scores, as well as inflammation. They also found that TUDCA lead to quite high rates of response in ulcerative colitis after only 6 weeks of usage. Next, let us compare how these compounds move through the body, because delivery matters. Remember NAC's 4 to 10% bioavailability problem? TUDCA does not share this limitation. It readily crosses the blood-brain barrier, achieves therapeutic concentrations in multiple organs, and distributes effectively to the endoplasmic reticulum, mitochondria, and nucleus where it is needed most. Let's look at safety and side effects side by side. Then we will cover medication interactions. In AC's clinical trials show up to 23% gastrointestinal intolerance, significant drug interactions, and concerning animal safety signals. TUDCA consistently shows quite good tolerability across human studies. Alia and colleagues' European Journal of Neurology study followed 34 amyotrophic lateral sclerosis patients taking 2 grams TUDCA daily for 54 weeks. The result, well tolerated in all patients with only mild diarrhea in 2 patients, the same rate as placebo, no serious adverse events attributed to TUDCA. Importantly, TUDCA may interact with several medications, including diabetes medications. It may bind to insulin receptors, potentially affecting insulin analogs and insulin sensitizers. It may interact with bile acid sequestrants, cholestyramine, cholestyramine, and cholesevelam, because these drugs can reduce TUDCA absorption. It may interact with doxycycline, a potential interaction exists, though clinical significance is unclear. Always consult your healthcare provider before taking TUDCA and NAC supplements to check for potential drug interactions with your current medications. Now, let me give you a practical comparison to wrap this up. While TUDCA and NAC both can be great supplements, I personally do preference TUDCA, especially for liver health. One fascinating finding, Paradaeans and colleagues' Liver International study showed NAC plus TUDCA combination significantly outperformed NAC alone for acetaminophen toxicity in mice. This suggests potential synergistic benefits worth investigating, though human data is lacking. NAC and TUDCA are often seen as synergistic pairs and are sold within the same supplements, so probably can be paired together. What are your thoughts? Have you used both of these supplements? And what has your experience been? Drop a comment below.